Here's the deal. Let's talk about face masks. Ever since the World Health Organization recommended the use of face masks for the general public back in June, many people backlash with a very stern rejection for these policies.
Look here! That man harassed me for not wearing a mask. I have a breathing problem.
See, I don't want to get into arguments about what Fauci did or about politicians doing this or that. Regardless of what any public figure does, the science is always the same. Therefore, I'm here to give you a very objective review of the evidence that's out there so you can see it for yourself. Let's start with a general idea behind masks. How are they supposed to work? Well, it's been known since the beginning of the pandemic that SARS-CoV-2 spreads through respiratory droplets containing infectious viruses. Although we tend to visualize these droplets only when we cough or sneeze, we can also produce them when singing, speaking, or even breathing. This shouldn't be surprising. We already knew of other diseases that are transmitted similarly, such as the common cold, influenza, tuberculosis, SARS, MERS, measles, or chickenpox. I mean, people have been studying the role of these droplets in disease transmission since literally 1934, as shown here in the study by Wells called On Airborne Infection, Droplets and Droplet Nuclei. Here are some examples. This is a natural sneeze captured by the New England Journal of Medicine, where you can appreciate the cloud of exhaled air in salivary drops. They reported that the largest droplets settled within 1 to 2 meters away from the person, while the smaller ones remained suspended and could travel up to 8 meters away. Here's another footage from the same journal showing a cough. There's also a cloud that effectively spreads through the air, as you can see. And they also recorded aerosols and droplets generated during speech, and they caught them by a green laser. And here, the person is saying, "Stay healthy" at different speech loudness, and they show what happens with and without a mask.
Stay healthy.
Great.
Stay healthy.
Great. Less loud.
Stay healthy.
Good.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
Now, these droplets can be split into two categories. The larger ones are usually produced during coughing or sneezing. They are 100 micrometers or more and can land on people's faces or on surfaces. Thankfully, because they're heavier, they don't travel very far due to the effect of gravity and end up falling down within a certain distance. Hence the social distancing rules. Get it? This accounts for contact transmission, whether it's direct between people or indirect through contaminated surfaces. Then there are smaller droplets called aerosols. They range from less than 5 to 10 micrometers and are so light that they remain suspended in the air for hours until they're carried away by light breeze or ventilation. Although we're not entirely sure whether COVID can be spread through these, this possibility is more concerning because it would mean there's an airborne transmission of the virus instead. So in this sense, the main purpose of the mask is to act as a barrier to stop these respiratory droplets from reaching other people or surfaces, therefore spreading the infection. There is a common misconception that face masks aren't effective because they're not able to filter out the actual viral particles. Some people even compare the size of a virus with the size of air molecules. Well, it is true that the regular surgical and cloth face masks we use can't filter out viral particles, but remember that these viruses don't just leave the body on their own. They live within respiratory droplets, and while SARS-CoV-2 is around 0.1 micrometers in diameter, these droplets range from 5 to hundreds of micrometers in size, most of which face masks are able to block effectively. And just for reference, in this graph of relative sizes, you can see that viruses are over here in the 100 nanometer range, while air molecules like oxygen or nitrogen will be found within this range of 0.1 nanometers or so, which is about 1,000 times smaller. So yeah, that's a big difference. Anyway, back to masks. Let's actually see them in action. There are some very helpful studies published in Physics of Fluids aimed to visualize the effectiveness of face masks in obstructing these respiratory jets. Let's start by looking at an N95. We can see droplets escaping from the top, but it very effectively stops that forward ejection, which is what we're trying to avoid. If we look at something more common like plain surgical masks, they actually examined 2 different commercial brands, none of which were ready for medical use. And here are the results. For the first one, the effectiveness is very similar to the N95 with the leakage from the top. However, the second surgical mask actually allows for some leakage of droplets through the mask, which says a lot about the quality of the material. Here's some more results of a similar experiment, but this time using a folded cotton handkerchief. And while this impedes much of the forward motion of the jet compared to no mask at all, there's considerable leakage of tracer droplets through the mask as well. And finally, being much more effective is the homemade mask with 2 layers of cotton fabric. While there is also some escape from the nose gap, there is minimal forward leakage through the material. Here's a nice summary of the distance traveled with these droplets with the different masks. The study determined that a stitched, well-fitted mask is the most effective, and a bandana made of t-shirt material is indeed the least effective. So please avoid wearing bandanas in closed spaces. So, what's the takeaway from all of this? First, masks are able to provide protection to others by blocking a considerable amount of respiratory droplets. This is the reason why masks are being required as a way to stop the spread of COVID-19. Makes sense. And second, they're not 100% perfect, so it's not the only measure we should apply. We saw in the videos that in many occasions there is some leakage of droplets even when wearing the masks. So this is the reason we should also maintain social distancing even when we have our masks on. Again, none of this is new. The mask studies didn't start in 2020 with the onset of the pandemic. Here's an optical study from 2009 of the human cough with and without masks. And one of their conclusions is that both surgical and N95 masks serve an important purpose in preventing airborne virus transmission by preventing the expelled cough from being projected forward. Same story. Now at this point in time, many people might say, yeah, sure, but there's no evidence that masks really work in practice. Well, actually, there is. The first kind of evidence we have is from reports like this one. 2 hairstylists who tested positive for COVID-19 continued working for 8 days, even after they developed symptoms. During that time, they serviced 139 clients, and after contact tracing, none of the clients reported signs of COVID-19. Of those 139, 67 people agreed to get tested, and all test results came back negative for SARS-CoV-2. Other stylists who worked at the same salon didn't develop COVID-19 symptoms either. So what did all these people have in common? They were all wearing face masks. Although not all clients were tested and this was not a control study, it is a nice example of how face coverings might have helped in preventing the disease. Also, I'm glad no one was affected, but these hairstylists should have stayed home after they developed symptoms. Just a side note. We can compare this to another report in which a super spreading event took place. After a 2.5-hour choir practice, it became known that 3 members had tested positive for SARS-CoV-2. A total of 61 persons attended the event and only 1 was symptomatic. Among those people, 52 cases were identified, 32 confirmed, and 20 probable, out of which 3 persons were hospitalized and 2 died. Of course, these 2 situations are very different. In the choir practice, people weren't wearing masks and the singing most likely contributed to faster transmission, but again, this sort of gives us an idea of how contagious this virus is and what can happen when precautions are not taken. But for those of you who want something more convincing, how about this cool study using hamsters? Well, this is how I like to think of it. This is what actually happened. The researchers placed healthy and SARS-CoV-2 infected hamsters in adjoining cages and separated some of them with surgical mask partitions. What they found is that while 66% of exposed hamsters became infected, only 25% of those hamsters protected by the mask materials caught SARS-CoV-2. And very interestingly, those infected hamsters who had the mask barriers actually had milder symptoms than their unprotected neighbors, most likely due to lower viral loads when masks were used. And this gets into the idea that masks might protect you as well, not just other people. In this paper from the Journal of General Internal Medicine, they explore the hypothesis of masks reducing the inoculum of virus to which the mask wearer is exposed. This means that even if you get infected, wearing a mask could reduce the number of viruses that enter your body, therefore causing a milder disease. Makes sense. There are also some preprints like this very long one, which I'll leave it in the description below, that reviews the literature behind mask wearing and concludes that there is evidence in favor of widespread mask use to reduce community transmission. Another preprint that is yet to be peer-reviewed found that per capita coronavirus mortality only increased by 15.8% per week in countries supporting public mask wearing, compared to 62.1% in the rest of the countries. That's 4 times higher rate of mortality increase in places where they didn't wear masks. There's another interesting study that looked at the effect of mask mandates in 15 US states plus Washington, D.C. between April and May. And they found an associated decline in daily COVID-19 growth rate by up to 2 percentage points after 21 or more days after the face mask orders were signed. They also estimated as a rough approximation that these mandates averted more than 200,000 COVID-19 cases by May. And if you really want to get into it, we can even look at this economic analysis saying that lockdowns are detrimental to economic activity and proposing a national mask mandate instead. By their calculations, they concluded that a face mask mandate could save us from a loss of nearly 5% of our GDP caused by lockdowns. That's potentially $1 trillion in losses. Sounds like a no-brainer to me. And I know this is a lot of papers, but there's one more thing that needs to be addressed. Masks are not dangerous. It's surprising to see how so many people believe that masks will increase your CO2 levels and acidify your blood or deplete you of oxygen, causing irreversible damage. There's, of course, a study to disprove this. These researchers found that gas exchange is not significantly affected by the use of surgical masks, even in subjects with severe lung impairment. Even in patients with severe COPD, they found no increase in CO2 retention. Oftentimes, the discomfort you feel is due to neurological reactions or psychological phenomena such as anxiety or claustrophobia, rather than actually not being able to breathe. In any case, despite all these studies, we should also keep in mind that the utmost scientific evidence that could, for once and for all, prove that masks work, which is a randomized control trial, is very difficult to do and probably even unethical in this situation. Therefore, our evidence is naturally limited, yet far from non-existent. And while face masks are great, they're not perfect, as I said before, and shouldn't be the only thing we do to prevent the spread of COVID-19. Think of the Swiss cheese model, in which each action is an extra layer of protection. I think the picture is very self-explanatory. In conclusion, just wear a mask. If people with COPD can do it, you surely can too.